Hello, everyone, and welcome to today's Triple Tree Thought Leadership session. Excuse me. Before we get started, I'd like to go over a few items to help you get the most out of today's session. You have joined the presentation listening using your computer speaker system by default. If you'd prefer to join over the telephone, just select telephone in the audio pane and the dial-in information will be displayed. You will have the opportunity to submit text questions to today's panelist by typing your questions into the question pane of the control panel. You may send in your questions at any time during the presentation. We will address questions throughout today's discussion. I'd now like to introduce Michael Carroll.
Good morning, everyone, and welcome to Market Insights Live. My name is Michael Carroll, and I'm the Chief Marketing Officer at Triple Tree. Today's session is focused on the trends impacting physician practice management organizations and what it takes to create successful PPM organizations. A reminder that the views and opinions expressed in today's conversation are those of our participants and do not necessarily reflect the official position or policy of Triple Tree and its affiliates. Also, just to remind folks, if you would like to ask questions, you can do that during the Q&A the question panel on your GoToWebinar setup here. And then to begin today, let's introduce today's panelists. We are fortunate to have three CEOs who are leading the growth of their respective businesses, and each of them is actually a seasoned healthcare executive and has grown organizations throughout their careers. First, I'd like to introduce Dr. Juliette Breeze. Juliette is CEO of Next Level Medical. Next Level offers advanced primary care and urgent care in both membership and traditional fee-for-service models. As a serial entrepreneur, she has developed several large group medical practices, private hospitals, and surgery centers. Dr. Breeze also serves on the board of two healthcare tech startup companies. Dr. Breeze, thanks for joining us today.
Thank you very much for having me.
Next, I'd like to introduce Matt Devine, CEO of Allied Digestive Health. Digestive Health is a large gastroenterology PPM backed by Assured Healthcare Partners. Prior to assuming his role at ADH, Matt spent 14 years in various leadership roles at Mednax, and most recently as president of the Radiology Solutions Division, which was acquired by Radiology Partners in December 2020. Matt, good to see you. Thanks for joining us today.
Thanks, Michael.
And finally, I'll introduce Eric Warthan, CEO of PartnerCare. PartnerCare is a pain management PPM backed by Shore Capital Partners. PartnerCare was founded in October 2020 and has experienced rapid growth since its inception. Prior to joining PartnerCare, Eric spent 12 years as a CEO of a physician-owned business enterprise and was the co-founder of a physician practice management consulting and revenue cycle management firm. Eric, great to have you today. Thanks for joining us.
Thanks, Michael.
As you can see, we've got a great panel today who will share some wonderful perspectives about what it takes to create successful PPM businesses. And finally, I'll introduce my colleague, Luke Mitchell, who's a managing director at Triple Tree. Luke specializes in healthcare services with a special focus on physician services and multi-site healthcare. Luke has focused exclusively in healthcare services during his investment banking career over the past 18 years. Luke, always good to see you again. And to begin today, Luke will share some perspectives on what's happening in the market right now to anchor today's panel conversation. So Luke, I'll pass things over to you.
Great, thank you very much, Michael, and thank you again to the participants, to our panelists. I think it's going to be a great discussion. It's obviously an active and exciting corner of the healthcare market, and I think we have a lot of great things to talk through today. So Michael, if you'll take it to the next slide, please. So for the uninitiated, physician practice management has become one of the most active deal environments within the broader healthcare ecosystem. We're talking about primarily private equity, but also independent companies that are aggregating physicians to improve access to care, make care delivery more efficient, improve clinical outcomes, and hopefully bend the cost curve of care delivery. Some of the reasons that we're seeing physician practice management platforms come together, we're in an environment where care delivery is getting increasingly more complex, as is the reimbursement environment. In certain medical specialties, we're seeing aging physician populations, and so businesses are looking for models that can deliver care with a diminishing number of physicians. In many specialties, there's an increasing gap between the availability of care and demand for services, particularly driven by the baby boomer generation, which demands better business models to deliver that care. And then also a fundamental shift in physician preferences, how they want to practice medicine, how they want to balance work life, and whether or not they want to go into solo practice and take on the financial risks of doing so. In the chart on the top right here, you can see the total number of PPM platforms, private equity backed, since 2010. The growth has been exceptional, and this is across many different specialties. On the bottom left, you can see how the current 292 private equity backed PPM platforms break out between dental, vision, dermatology, and urgent care. The growth has been spectacular, and there's really no sign of it abating. And then finally, we touch on what are some of the various drivers of valuation as it relates to physician practice management. Number one driver of valuation, and really success overall in practice management, ability to successfully recruit and retain physicians. None of these businesses work without well-incented and engaged physicians. Flexible care delivery models to meet the needs of local markets. Ability to leverage ancillary services to provide more comprehensive care. And then the ability to demonstrate first-class clinical outcomes. We're fortunate because on our panel, we have 3 really exceptional PPM leaders, all running very different businesses, different backing, different history, but with some really wonderful common themes across them. So I'm excited to engage with them on a variety of questions here. So let's maybe start with a quick overview of each of your companies. And Dr. Breeze, if you wouldn't mind kicking it off and starting with a little bit of background around Next Level.
Sure. Well, Next Level kind of came into existence really in 2013 when Houston, where I am, had a scourge of freestanding emergency rooms, one on every corner. And in order for people to get care on the weekends and at night, they were entering these places that looked pretty innocuous. They were in strip centers and looked like regular clinics, but then when you went in, it was thousands of dollars for the care that they received. So I got stung myself and realized that there had to be a better way. So started putting together a plan to create alternatives for weekend and night care in our city. And really how I did that was economies of scale. We created a bunch of clinics managed by one entity that could basically drive some cost efficiencies. And then over time, what has been amazing is this evolution, and of course the pandemic put the evolution on speed drive, but we started really just focusing on what else is there in cost-effective care. How can we deliver healthcare in a more accessible and affordable manner? So now, 8 years later, we have expanded our services to include primary care in a membership model, telemedicine. We do clinical research. We do lab. We've, as you just mentioned, sort of started to develop a more comprehensive model that provides care to an employer-based employer-patient base.
Very cool. All right, well, great. Well, we're glad to have you. Matt, why don't you give us a little bit of background on Allied Digestive Health, if you would.
Sure. Allied Digestive Health was really started about 5 years ago. There's 5 GI groups here in the state of New Jersey that came together. They kind of did the PE rounds and picked Assured Healthcare Partners as their private equity sponsor going forward. That happened in December of 2020. At the time, there were about 54 doctors, GIs, and now we're about 96, should be over 100 by the end of the year here. We've got to squeeze and work hard to get this done, but over 100. And then we have pathologists as well, and we have anesthesiologists. So all told, we almost have about 125 physicians that are part of our group today. So pretty much double the size of the group in the first year here since private equity got involved with the company. Really what's unique about us is we're kind of a little bit different in that, we're all acquisitions, internal growth. So we focus on growing and getting density in our markets. So we have a lot of ancillaries. So where I came from at Mednax, a lot of the services were hospital-based, and it's harder to develop ancillaries in a hospital-based setting, whereas in an outpatient setting, you can develop other ancillaries. By that I mean anesthesia, pathology. We can add a lot more value to the physicians as they join us. They're not able to do that on their own. So today we're about, as I said, 96 GIs. We're really stretched from Cape May all the way to Bergen County, New Jersey, which is up at the top of the state. So we really cover the whole state. In the Northeast part of the United States, we're the biggest GI provider. We have a lot of aggressive plans to grow, but we've really focused on getting density. So I think that's really kind of unique out there, that we haven't tried to go out and acquire practices all throughout the United States and get platforms all throughout the United States. We try to really focus in on developing value really for our physicians. It's hard to develop a lot of value across state lines, but you can create value within a state. So that's what we've really focused on. We'll have more growth going forward this year outside of the state of New Jersey. But the whole idea here is to be very focused on growing. And I think the one message I have really, Luke, is that you can't just be doing acquisitions. You have to go out there and you have to organically grow your practices to really add value. So as I said,
sure.
Most of my career in health services just started in 2007. I saw your slide there. It said that there were 17 providers in 2010. I think I started in 2007. There weren't many providers, and the multiples were a lot lower than they are today. So yeah, that's kind of my story, and I look forward to your questions today.
Yeah, well, thanks, Matt. Yeah, we've been doing this a long time, but I mean, the growth in the number of platforms is really, really incredible. Eric, why don't you give us some background on PartnerCare, if you would? We'd love to hear a little bit of the story there.
Yeah, so PartnerCare, we're an interventional pain management platform backed by Shore Capital Partners. Shore is a private equity firm based in Chicago. One thing that Shore does that's a little different than most investors in this space is they're actually microcap investors. And what that means is they look to partner with small to medium-sized businesses, or in our case, practices, to get started, with the idea that they can really help those organizations, if we create the right alignment, and be able to bring capital and bandwidth to allow people to grow. And because those smaller organizations are often hamstrung, they have limitations. Time and treasure, bandwidth and capital are both scarce resources in all physician organizations, but especially smaller ones. And we all know that it's an increasingly complex environment. It's a difficult environment to operate in, and scale really helps. It really makes a difference whether you're dealing with your EHR, your compliance plan, getting more physicians to join, talking to payers, talking to health systems, creating strong market strategies, being a resource for primary care groups where they can refer their patients to you. All those things are helped by scale. What we see in the pain management space is we see a really fragmented industry. So a large practice in pain management is not what I would traditionally think of as a large practice. It's very focused on small groups scattered all over. So Shore is really the perfect organization, the perfect partner to come into this space. And we're about a year old. We're in 3 states today. By the end of the first quarter, we'll be in 6 states. We'll cross probably 100 providers by the end of the first quarter, just as we close some letters of intent that we have outstanding. And we're excited by the growth curve, and we're excited to be in this space. I think pain management is a nascent space for investment, and I think there's a lot of opportunity to provide value, and for payers, for purchasers of care. We all know about the opioid crisis, and look, we have the opportunity to work with patients who have incredible needs. They're literally physically in pain when they come to our practices. And so from a mission basis, the opportunity we have to help those patients, to help their lives, and then go upstream as we think about a larger integrated platform and really work with purchasers and help them meet their needs is incredibly exciting. And so I think there's just a ton of opportunity in our space, and we're excited to, again, be in the early stages of both our business and what I think is going to be a developing industry around pain management.
Yeah. Well, that's great, Eric. And yeah, I think it's interesting. I mean, all three of you, without any prompting, touched on the idea of scale and the importance of scale. And that's something in my travels, speaking a lot with independent physician groups and physician groups that are going through sale processes. So many doctors, older doctors, younger doctors, have a vision about where they want to take their practice, but it's without having some amount of scale, it's really difficult to achieve some of these, really important changes that a lot of practices are trying to achieve. So scale is something that we'll touch on in a little bit. But first, let's talk about growth. You're all running different businesses. Growth comes in different forms for each one of you. There's the de novo strategy, there's the acquisition strategy. One of you is independent, two of you are private equity backed. Matt, you used to run a publicly traded company. I would love to hear kind of, for each of your businesses, what is your growth strategy? What do you see as the pros and cons? And what are the advantages or disadvantages of your capitalization and ownership? So Dr. Breeze, maybe let's start with you, if you wouldn't mind.
You keep picking on me. Okay, I will tell you about our growth strategy. So honestly, we started out, it was just friends and family, were backing my efforts, and we grew to about 17 centers with just sort of that, and it was a lot of centers at once, and then organic, we using earnings and piling it back into the growth. And I did kind of consider, now we're up to, we'll have 25 clinics in early 2022 in Houston for just urgent care. We have another 6 that are on-site employer-based clinics. That's brings us to 31, and now we're expanding into Austin and San Antonio. That's our next foray, is basically going out into the rest of Texas and bringing our platform. And so in order to do that, obviously we need a little more capital than it's a little bit of an investment. One of the things that I tried to do to make that possible is that I looked at a different model. So the model that we had been in was fee for service. It was insurance based, and I had to provide the service and then wait for payment, sometimes wait a long time. Moving into a membership model really changes the game. It allows me to grow a lot faster. I can secure contracts and have known revenues, and so I can, it's a lot easier to take on some debt if you know you're going to get paid. So those are the kind of things that we've done in order to ensure that we can scale even without a big backer, which we don't have yet.
Okay, thank you. And Matt and Eric, both of your organizations are private equity backed. Maybe Eric, let's start with you. I mean, you've led several single specialty groups, both independent and as well as institutionally backed. Contrast for us the challenges of growing, maybe 2 of those organizations. What are some of the challenges? What are some of the benefits of having that institutional backing?
Honestly, it's a heck of a lot easier. Juliet, hats off to you. I don't think I'd go back. And so when we were building a large physician enterprise without the backing of capital, we were really using a lot of debt, and we use debt incredibly effectively. You're obviously using earnings, but those earnings, in our case, we had a large shareholder base. Those are the shareholders' personal take-home income, and ultimately, there's only so much of that you can use going forward on a each deal each year. And so the question is, how can you keep growing and growing aggressively while still trying to grow your shareholders' income each year? And we successfully did it for a long time. I'm proud of the work that we did, but we really had gotten to the end of the runway. We were at a point where to take the next step, and I noticed Juliet said yet, and we had gotten to the point on capital. And so we'd gotten to the point where to keep growing the way that we were, if that was the goal and the goal of the shareholder base, we were going to have to make some different choices probably going forward. So with that in mind, I think it's hard. I think that you can create growth and accelerated growth up to a certain point without a capital backer, but I do think you run out of runway. And I just think you have to evaluate what you want for the business and where you want it to go. That can be okay, and it doesn't mean you need to bring in capital. I always say to any physician organization that's talking about bringing in capital, really understand why you want to do it. There needs to be a good reason, and it shouldn't just be a short-term cash play or everybody wants to just check out and retire. Those are the wrong reasons, frankly. There's nothing wrong with being monetized for your life's work, but that's probably not the right timing and the right way to go about it. So I prefer doing it in the capital back space. And I was intentional about making the change over to the capital back space. I had a real interest in this. And I felt like in the capital back space, there weren't a lot of people who had been true operators in a physician-owned environment. PPM businesses, they're different. And they're different than everything else in healthcare. And it's not that they're good or bad, they're just different. And working with physicians directly is different. And so I felt like there was a real opportunity to take the things that I had learned and done throughout my career and cross it over. I think the real key to growth today is to try to bridge two disparate concepts. And by the way, I don't think that many people do it very well. And one is to be a good operator and to be good at M&A. And if you can bridge those two things, I think you have magic. The reason people typically aren't good at both is they're very different disciplines. And the people who are good operators are not M&A focused leaders and vice versa. And as we think about organic growth and operating our businesses, we use the framing with our partner physicians and people we talk to about selling is we want to help your practice flourish. So we're going to optimize it. We're going to help you bring best practices together. And by the way, you've done a lot of great things to get here, but what got you here may not get you there or where you want to go. How do we optimize? How do we build together? And it's a partnership. It's not we come in and say do X, Y, and Z, right? We work together with people. And then we flow forward with the growth and we talk about de novos. How do we open new clinics? Some of the things Juliet was just talking about. How do we build new ancillary programs and products? Matt was really referencing that when he talked about bringing pathologists on and new programs there. And then we bridge that all the way to the M&A. And what we've done is we've been really intentional with our team development around our core team members who are focused on operations come from physician enterprises. Our chief human resource officer, our VP of marketing, our VP of operations, our CIO. Those are all people who've been in physician enterprise level businesses. Then our M&A people are people who've done private equity backed work. Our finance team comes from that world. And then we really create a siloless organization and bridge those two things together. I think to create hypergrowth, that bridging, bringing those teams together is really the secret sauce.
Yeah, well, and I think to a comment you made a few seconds ago, I mean, this is really cutting edge healthcare delivery, right? I mean, you all are all trying to do something or create models where there is no playbook. You know, this isn't like a lot of other sectors in the economy or even within healthcare where you can say, well, this is the way it's been done for 20 years. And you know, I think it's really interesting that there aren't. Well, we're all learning on the fly a little bit. You know, we experiment through trial and error, and you know, we know that as long as we stay centered around patient care and physician relationships, that we'll get there. But you know, of the 292 PPM models right now, probably 280 of them have you know a slightly different take on the right way to grow these sorts of institutions. So Matt, you know, having been within the environment of a public company and now being in an organization that's private equity backed, how do you think about growth and what are some of the things that you've had to do differently or perhaps get to do differently than you did when you were working with a larger publicly backed company?
Well, that could take a long time to answer that question, but I mean, public companies, you know, the onus is on us to, you know, we were basically doing acquisitions, as you know, Luke, like hundreds of acquisitions a year. Like we do not a year, but over the course of several years, we do about 20 acquisitions a year. And this was going on for many, many years. And so, you know, there really is a demand, an appetite, insatiable appetite to meet, you know, the growth projections on Wall Street. Is, you know, we're valued as a growth stock. So you had to meet these growth projections out there. And the key is, you know, you're doing acquisitions on the one hand, and you got to focus on the organic growth because the organic growth, you know, that's what's going to keep physicians happy. That's what's going to have the highest return, if you will, for investors, where you're not putting your own capital there. So my view is general is like in private equity backed companies, we really have to figure out how do we grow top line revenue, not only through acquisition, but organic growth. So we do a lot of like hyper targeting. And let me just back up one second. My Mednex days were very much hospital based. And so hospital based is very hard to grow. I mean, just because the hospital itself isn't getting the growth that, you know, a lot of their physicians are outside of the hospital. They're moving outside of the hospital. Alternative, you know, forms of delivery are being created all the time. So they're under a lot of stress, and it's hard to get them to grow at the rates of growth that we want. So in GI, we're growing GI, and it's all in an outpatient setting for the most part. I mean, we do provide services at the hospital, but that's not what's really driving the growth. It's more outpatient. And so, to me, we have to come up with strategies, marketing strategies, where we have to understand where our physicians are getting their referrals and where our competitors are getting their referrals, and we have to actually go out and target those referral sources, which again we never did years ago. But I think the private equity world's really caught on to that you have to be out there marketing your services. It's something kind of contrary to what a physician would normally think. You know, they come and patients come to them and they serve the patient. But we have, you know, if you look at some really successful private equity models out there, they've been able to grow through alternative means. So like we're doing hyper targeting. So we're actually, you know, using social media to target patient bases. So that's just another way that we can grow our existing patient base, if you will, and do it in an aggressive manner that adds income repair, if you will, to our physicians. So really focused on that. I think it's, you know, again, when you're outpatient, you're really trying to get patients in the door. You're dependent on getting patients in the door. When you're hospital-based, you're not really focused on, you know, bringing patients to the hospital. You're more focused on, you know, it's the pitcher catcher scenario. You know, you're more of a catcher when you're in a hospital setting, and on the outside, you know, we're out there trying to figure out how do I get more patients and throughput through my outpatient centers. So marketing strategies are absolutely essential to adding value in at least in an outpatient setting. And so we're really focused on that, and really focused on, you know, again, growth. You know, we're focused on payers. You know, like payers used to be, I don't know, we had much more of an adversarial relationship 10, 15 years ago with payers than we have today. Now we're working together with payers to create strategies where we can serve patients before they end up in the hospital. So we're trying to aggressively, you know, put together nutrition programs where, you know, we're seeing the beginnings of disease, and then we're trying to treat it before it becomes, you know, a hospital event. So we're working with the payers on value creation, and that, to me, you know, patient engagement is essential, but payer engagement is essential now. So my view on payers is, you know, extremely positive now. I've looked at them as somebody that we want to partner with, and we think there's great value in doing that. And so far, it's worked really well for us here at Ally.
That's great. Yeah, and Eric, I mean, you know, your platform, there hasn't been nearly as much consolidation activity in interventional pain management. What has been the tenor of the dialogue with payers, and how have they been receptive or not receptive, you know, to what you all are trying to do in the Southeast?
Yeah, I think on your donut graph, we were in the other category. We didn't get a specific designation like some people did. So payers are eager for help. And I think Matt's point is, how do you view the payer? Do you view them as, you know, the enemy on the other side of the table, and we're negotiating for a few percentage points of reimbursement? Or are you sitting down with them as a partner to say, listen, I think we can help you solve some challenges. I think we can do it in a way that helps us, and most importantly, helps our respective patients, and in their case, the beneficiary. And so if you approach it the right way, I think you can have really, really meaningful discussions with payers, and you can really flip that script and now start to talk in a way that solves problems really across the healthcare system and creates value for purchasers of care. Sometimes that's an employer, sometimes it's a fully insured product, sometimes it's the government, sometimes it's the patient. But there's an incredible opportunity, certainly in our space, and I think in most spaces, although the opportunities look different by specialty, but in our space, you think about the opioid crisis, you think about the idea of making sure the patient has the right level of care at the right time. In other words, they don't race toward an incredibly invasive intervention without trying different modalities of care first and really exhausting all of those things. In our space, there's an incredible psychological component that can come into play, and ways that we can bring resources to bear to help patients really think about and try to manage their pain differently, and come to an understanding of where they're at, and again, help them navigate and work through that process. And by being able to deliver that suite of services to patients, when you sit down with a payer and you start to talk through and say, and look, we're measuring these things and we're helping this percentage of patients get off narcotics through these programs, that really begins to change the conversation. And we're just scratching the surface because we're so young. And really for us, Matt talked about density. The importance of density is to have payers are regional. Yeah, there's national payers, but payers are really regional. They're local businesses like health, like our delivery system is. And so you need to have the density to be able to provide solutions to a regional payer. And so we're just getting started with that, but I'm incredibly, incredibly bullish on where we're going to go with that. We're working hard and talking about bringing alternative payment structures into partner care. We're talking to a group right now that has a capitated agreement, and one of the reasons I'd love to partner with them is to bring that knowledge in. I've done alternative payments in the musculoskeletal space, and I know there's incredible opportunity there, and I'm excited about it. And you know, you think about what Juliet described, and correct me if I'm wrong, Juliet, you literally have created your own payer, right, with your member model, and I think that's interesting too. You know, as we think about alternative ways for our business and alternative ways to partner with what I'll call the purchaser of care.
Yeah, well, and Dr. Breeze, maybe if you could speak. I mean, you know, the dynamics with payers for urgent care, I think it's, you know, relatively well understood. This is your 9th or 10th rodeo leading a healthcare platform. How has the education and the conversation been as you've been kind of proactively looking to engage in dialogue with the employers and, you know, essentially shift your payer universe? How much education has been involved in trying to achieve that? How easy of a sell has it been?
Well, it's actually becoming an easier sell, and again, I feel like everything is just the speed of change has been so exponential through the pandemic. But when we had this idea, we started kind of socializing it with employers that we were already doing other things with. We were providing work injury care and other things. So we would say, hey, we have this idea. And they were really leery because that wasn't how they got healthcare. They, you know, had a plan and they went through their plan, and they didn't really understand having anything carved out or anything that was an add-on. And now with the way things have gone and just the incredible, I mean, there's a couple things at play here right now that are making it an easier conversation. One is that the price of their premiums is going up, and we've had a lot of people contact us recently because in order to make it budget neutral, or even just not as bad of a hit, they're having to increase deductibles, narrow networks, and they want something that makes up for that for the patient. So in our model, the patients pay nothing in our centers. They never take their wallet out for lab or x-ray or anything that they do in our centers. And that makes it an incredible benefit to an employee. And so what employers are coming to us with now, which is new, is it's great. It sounds good that you can save me money, but actually, if you can just keep my employees happy, if I can just beat my competitor to this really tight labor market, I will be happy. So that's been really on our side, and it was something that was an unplanned event that we have sort of found ourselves in this perfect situation where we have something that people really perceive as a great benefit to give to their employees. But
yeah,
actually,
I have to believe. Go ahead.
Sorry, I was just going to say on the payer side, I'm actually having conversations with payers also, because even though we started out this model as, okay, this is going to be outside of typical insurance, and there's a lot of reasons obviously to do that. The biggest one is that it's cheaper. I don't have to have a huge billing department to get my claims paid. I don't have to run eligibility or put together claims or do anything. We just have a list of people that they're going to pay for every month, and I get a check. And so that really saves an unbelievable amount of money, and I pass that on to the employers that we are working with. But recently, I've had a really great conversations with several payers that see the value, can understand they're hearing their customers' pain over the the costs and access and all of that, and so they're actually saying, maybe we could do the same thing for you, provide an easy payment, and roll you under a plan. So we haven't gotten there yet, but I mean, I think that these are things that weren't even conceivable just a few years ago, and now the payers are coming and really we're having great conversations.
Yeah, that's really exciting. Well, I think one of the next things we wanted to talk about was physician alignment, and knowing you all as individuals and professionals, I know that all four of us share a belief that none of these businesses work if you don't have really exceptional clinicians who are really exceptionally engaged in delivering care and working within in this environment. Maybe I'm going to kind of walk through each one of you, but if you can maybe just talk a little bit about how you think about physician alignment. What are the resources that you believe you can deliver to help keep physicians engaged, and things like that. So Eric, maybe let's start with you. I mean, I think given where you're playing, probably more so even than the other professionals on this call, your physicians tend to probably need scale and resources, perhaps a little bit more than within some other specialties. It's not a particularly well understood specialty. What are some of the things that you're bringing to bear as it relates to physicians, making sure that they have what they need and making sure that their interests are really aligned with what the organizations are?
Yeah, so leadership ultimately is around building a vision and taking a team and getting everybody to buy into that and walking toward that vision together at the end of the day. And so we start everything around that. And so it starts with really aligning and partnering with the right physicians. So people who want to focus on patients, people who want to focus on their employees. Yeah, we're capital backed, but that doesn't change any of those important components. People who believe in our values. And we really line all that stuff up at the very beginning. We talk about it constantly, pre-close, post-close, et cetera. And then people who want to grow. So we start there with just the right people who want to buy in and want to believe and want to be part of something that's just bigger than themselves. But what we find is we're just able to take so much burden off a small entrepreneurial practice where, they just don't have the resources to do rev cycle well. Sometimes they outsource it. Sometimes it goes well. Sometimes it doesn't. And, they don't have an EHR that is very robust. They have a simple one and it works, and that's okay. But you can't get any data out of them. You can't scale. And as we talk about these payer conversations, what's one of the things you have to have? You have to have data. You have to be able to show what's happening to your patient base. You have to prove that out. And so suddenly we don't have those things, or they don't have those things. And so we can start to bring some of those things to bear. We can start to bring to bear HR resources that they don't have, operational resources they don't have. And we can just marketing resources they may not have. And again, sometimes they have some of those things. They usually just don't have all of them. Sometimes their administrator is wearing a million hats. We see some great folks out there, but we can take a burden off them and let them focus on what really matters, focus on patients, focus on staff engagement, work with us. We can provide systems to do those things. And all of those things are incredibly powerful.
Yeah, and that's helpful, Eric. Matt, in terms of what you've seen both within your current organization and earlier organizations, as you think about physician alignment, enterprise alignment, what do you think has worked, and perhaps maybe what hasn't worked, or what are some of the lessons learned through the years?
I've certainly learned some lessons. So, look, physicians don't want to work for a salary. Okay, they want upside. They want, from our model. So, as a publicly traded company, it's very hard to get physicians equity. It's public equity. It's very hard to do. So, working for just a salary, in my mind, is not something that is going to motivate and incentivize physicians as the salary kind of model that they don't have any skin in the game, if you will. So, and we had that, in the publicly traded setting, we had that. That's kind of what happened. And I think that's not an ideal model. Ideal model is kind of what we have now. I mean, physicians roll, when they come and join us, they roll equity. They're 40% of the equity, they're rolling into the deal here. So they are our partners. We have great alignment as a result of their level. We have great physician leadership. I like to say no decisions made around here that's going to affect a physician without a physician weighing in on it. We have different leadership councils. So, when we change, we're changing our back office practice management system to Athena. They're involved in that decision. So pretty much everything that we decide here at the MSO, they have input on. So again, equity helps. It's critical. They have skin in the game. They're motivated. It's a great partnership. And so without alignment, it's very difficult, I think, to be successful. So, I mean, they have input on everything. And so when it's about growth, they're super excited. We have a young physicians council, so they're involved, the younger docs involved. We got equity for younger physicians in the practice that, they're involved as far as when they join, they're just not, going to be any longer just a paid physician. They're getting equity in the transaction itself to come. So I think, that's critical. Without good alignment, you're not going to be very successful, in my opinion, and you got to push down equity into the hands of the physicians if at all possible. So that's worked for us.
Matt, I think that's spot on. I think you hit on a couple of just incredibly critical things and some things that we try to do as well. So often, when you have a practice who comes in and joins a private equity-backed organization, you may have one seller physician, you may have a series of shareholders, you see different structures. But certainly where we have situations where we have physicians who are not yet shareholders in an organization, again, whether they're employed or on a shareholder track, we have an equity program for them where they can buy in to the PartnerCare platform. And that's critical. We want every physician to come in and have equity. It's really the new shareholder track for that you would see in private practice. This is the private equity version of it. And we want those physicians, those young physicians, those non-seller or equity-based physicians at the time of the transaction to buy in. And because we want them to be invested long-term in that vision I talked about earlier and grow with us and be excited about that and benefit from that. So like Matt, we have a program for that. We also do our physician councils, I think, in a very similar manner. And I think for anybody who is a seller, if you talk to a company that doesn't have a program like that, I would be concerned primarily because what's the long-term growth to attract young physicians and make it interesting and engaging for them? You want them to have a pathway, you want them to have an engagement pathway, and you want them to have an increased economic opportunity. So I think those things are really critical.
Well, so Dr. Breeze, I mean, I know when we've spoken in the past, you have a slightly different tack to how you work with and engage your physicians, and it's very much about the mission and delivering care, and you're really focused on a slightly different set of motivations. Talk to us about how does that manifest itself when you're recruiting, when you're trying to engage these doctors, when you're trying to make sure that you have somebody who's going to be here not for the next couple of years, but for the next 10 years, and what has worked really well for you in terms of attracting really top flight talent?
Well, first of all, I think that there's a couple of differences in my world from Matt and Eric's world. And one of the big differences is that they're dealing with specialists. And there is a very different mindset. I used to run an orthopedic practice, and I would have agreed wholeheartedly with everything that they both just said. But primary care doctors are actually just different beasts. And so there's a couple things. Number one is that the doctors that are attracted to what we do would give any amount of money to have the lifestyle that we are promoting here. So they're not money driven. They want to have 4 or 5 days off a week. And so, we have shift work. Our shifts begin at 9 a.m. They end at 9 p.m. or around there. They can work a full-time job with, a couple of shifts a week. And they can enjoy being entirely off, meaning no contact with them on their days off. And that is something that these people really, really value. And we, of course, try to make a really team-based environment. There's a lot of support for our practicing physicians and our advanced practice providers. They enjoy each other. We've developed a very strong culture in the organization around, fun and family and friends and teamwork. And money is just not as big of a driver in our organization, which I can't believe I'm saying. I mean, honestly, I came from the exact opposite, where we couldn't even have a conversation about, anything without talking about who is getting the bigger share of it. And these guys just really, they don't need it. They want to raise their families. A lot of our physicians are younger. A lot of our advanced practice providers are younger. They're in the family stage. So time with their young children is more important than anything to them. So that's our take. It's a little different, but all strokes.
Well, it's working well for you. Okay. Well, maybe I'll leave you in the hot seat. One of the things we talked about previously too is when you think about providers, we talked about systems, we've talked about growth. Let's talk about the idea of value creation. How do you take these individual ingredients and make something that's bigger than the individual components? When you think about value creation for your employees, for the patient, and how does that manifest itself? And what do you think you're doing that is different than just a doctor out there on their own?
Well, I mean, I think for one, the people that have joined us really actually believe in changing healthcare. They believe in what we're doing with our platform and making healthcare more accessible, more available, less costly. Almost all of my providers have a family practice background, and so they are very kind of holistic in their view of healthcare in general. And so we, from the standpoint of value creation for my staff members, there is nothing stronger for them than being involved in something that they believe is doing good in the world. So that's kind of that track. For our patients, it is sort of thrilling to be able to say, hey, you're never going to take your wallet out in our place, and welcome, we want to help you. We've been very excited about using the team-based approach, which is different in healthcare. We have our health coaches, we have our RN care navigators, we have our virtual providers, all participating in the care of the patient. So when a patient is seen for something very routine, they get a lot of face time with a lot of different individuals, so they feel like they matter. And I think that that's something that has been lost a little bit in healthcare. And a lot of that, we're just one way. We're one group trying this way, but right now out there are a million different ways, and everybody is trying to answer the question of how do we get back to something that makes people feel good about going to the doctor. And we just, you know, we wrecked it in so many different ways. We made the appointments too short. We made it really a big hassle for payment. We made it a big hassle for even getting in. Everything, nothing about the way we deliver healthcare in this country is fantastic. So there's going to be a lot of different ideas out there. There's going to be some that lead to better things. And that's, you know, that's kind of where my group is interested, is in trying to, you know, move us along in the right direction.
Okay. Well, and Matt, how do you think about value creation, whether it's for the physicians, for the patients, for the payers?
Okay. Well, I think, you know, and you started that question originally by like, how is it different than being on their own? I think, you know, being on their own, you know, we're really focused on clinical innovation and creating programs where we can provide value add going forward. So we're kind of working with payers on innovation. We're engaging payers, whereas physicians on their own or small groups of physicians can't really engage the payer. So we're really, payer engagement is critical, creating wellness programs that we can, you know, kind of layer over the top of our practices through input through our physicians and the payer community, I think is critical. You know, clearly we're as we've grown, we've been able to give the benefits of that growth, some of the benefits of that growth to our physician partners. They've been the beneficiary of that growth, if you will. So, you know, many of our physicians didn't have all the ancillaries that we provide today. So, you know, there's, you know, Luke, before, you know, when we kind of started out like way back when in anesthesia, you know, groups, you know, and endo groups were kind of going out to providers and kind of getting, you know, like the big providers like Envision and groups like that to provide anesthesia. Well, we provide that now. So we're providing all the anesthesia. You know, we have enough size to go out there and employ these anesthesiologists and be able to move them around, whereas a small group doesn't have that capability. So all these things have really added a lot of value to their practices. So we want to add value in as a result of our scale, but we also want to add value in innovation, if you will. And we want to kind of look at wellness is huge to us. I mean, that's kind of a big area of growth for us going forward. And so our focus is on how do we keep patients, how do we treat them, you know, early on rather than wait for them to have an event. So kind of engagement with the payer, I think, is huge in that respect. So I think that's very hard to do as a small practitioner, if you will. And so I think some of these groups, as groups have gotten scale, they've also got, you know, innovation has followed. So I think overall, you know, this chart that you showed with all these different private equity sponsors getting involved in that, I think it's good for healthcare in the long run, and I think it'll create innovation. I think it'll create you know, a more efficient delivery of the service and a reduced cost for the service long term. So I think that small groups, if they're not looking at that now, I think eventually they're going to be forced to do it. You know, here, a lot of our, you know, we've spent a lot on technology, innovation, and those things all cost money. And I think it's hard for small groups to continue to do that going forward.
Yeah, no, I agree. Eric, you know, you touched on a lot of this. You know, as you think about value creation, when you're out there meeting with, I mean, given that your model really is M&A driven, you know, what is the pitch to these targets? I mean, in terms of how you're going to help them, how are you going to help them, or how are you all together as a combined entity going to be able to create additional value together?
Yeah, so we literally start with mission when we sit down with a selling physicians. And look, our mission is around patient care. It's helping patients live their best lives possible. We recognize people can have conditions that can create some limitations. Hopefully we can remove all of those or some of those, but it starts with mission for us. And we talk to doctors specifically about patients and starting there. And then we talk to them about their employees. And because we want to partner with people that care about their employees, that care about their culture. And for people that's a secondary concern, we might not be the right partner for them, and that's okay. But we start there. and really build everything around that. And if we do that well, the other pieces are actually going to take care of themselves. It sounds silly, but it's true. And so we sit down once we've partnered with somebody during actually our due diligence stage, post LOI, but pre-close. We then will sit down with the physician group and the physician leaders and their administrators and build up what we call the value creation plan. So we go through the steps of our grow and flourish that I mentioned earlier, and we go through how we're going to do that together. But as Matt said earlier, we engage them in that process. It's them bringing those ideas forward. We have a framework that we work within, but we really identify the 5-year opportunities that we have together and what we're going to approach. And then we build out a strategic plan that flows out of that, both operationally, from a mission, vision, value standpoint. And by the way, we do MVV meetings, we call them, with staff. We talk about values at the close meetings. We then come out and do meetings around values with team members through our HR department. And these are the connection points that we need to kind of create one company. I think creating one company is a differentiator in this space. We don't want to be a constellation of 20 companies spread all over the country. We need to be one company. That's why we're going to one EHR. We've got to have the data, one conversation with the payers, some clinical standards. Not our providers still have full clinical autonomy. I want to be clear about that. But what are best practices? What are the outcomes we're now going to use technology to capture? And so all of those things begin to blend together. And that's how we see creating value ultimately then for our shareholders downstream. That's how we're going to optimize the platform and the business. But it all starts all the way back at mission. It all starts all the way back at our vision and our values and bringing those things together.
Yeah, amen. Well, Michael's going to wrap us up here. We're running out of time, but I want to ask one lightning round question that you all were not prepared for, but you can just answer with a show of hands. 5 years from now, so there's currently 292 PE-backed PPM platforms, and that was as of last week. I mean, who knows how many there are this week. 5 years from now, do you think there'll be more platforms or fewer? Raise your hand if you think it's going to be more platforms 5 years from now. Okay. All right. Well, Matt, we've seen what happened in the hospital specialty, so well, that's great. Well, I can't tell you all how much I appreciate you all participating in this panel, and I'll hand it off to Michael.
Thanks, Luke. Hey, and one question from the audience that I thought I'll just throw out as an audible here. Question around the role of practice management platforms and EMR platforms. Would you think about them? They're built today for more individual practices. Do they actually meet the needs of your businesses, and what do they need to do differently going forward? Maybe just a quick 30-second lightning round response to that one question.
What do you want?
Yeah, I'll go first. I think that what we see is the smaller EHRs that we'll see do not meet the needs of our business. However, there are platforms that can bridge and provide the resources you need. And I don't think you have to go all the way to an Epic or a Cerner. I think there are platforms in between the entry-level EHRs that you see again at a solo office or a small group practice. Those don't meet our data needs. They don't meet scalability needs. They're fine for the small practice, but they don't work. However, there are platforms that I think bridge halfway in between, again, the huge enterprise scale systems and the small systems. So I do think there's systems out there that can work.
Great. Well, that concludes today's conversation, today's Market Insights live session. I'll echo Luke's sentiment. Juliet, Matt, and Eric, thanks for joining us today. A reminder to our audience that you can view a replay of today's session on TripleTree's website, as well as you can actually listen on your favorite podcast channel. We'll be back in early January for our next Market Insights live session focused on the trends shaping the M&A activity in 2022. On behalf of everyone here at TripleTree, we wish you a happy, healthy, and prosperous new year. Thanks again.
Thank you. Take care.